This lecture is going to be on causes of hyperphosphatemia. This is a list of the main causes of hyperphosphatemia, along with a mnemonic to remember those causes. Of all of these causes, decreased GFR due to dehydration or renal failure is the most common cause of hyperphosphatemia. This lecture will only expand upon those causes that are not self-explanatory and those causes that have not been covered in other lectures. In vitro hemolysis is hemolysis that occurs in the sample and not in the patient. It can occur with difficulty obtaining the sample, prolonged storage of the sample prior to serum separation, and also with freezing the sample. Substances at higher concentrations inside the red blood cells, such as phosphorus, potassium, magnesium, and AST, are all released into the plasma or serum, thus causing false increases in all of these substances. However, most dog breeds do not have red blood cells with high potassium content, so hyperkalemia does not occur in most dogs. Also, cattle red blood cells do not have high magnesium content, so hypermagnesemia does not occur in cattle. Sodium phosphate enema administration can cause severe hyperphosphatemia in animals. To date, toxicity has only been reported in cats and small dogs such as dachshunds. When the enema is administered, the phosphate and the sodium are absorbed into the bloodstream, causing marked hyperphosphatemia and hypernatremia. The hyperphosphatemia is so severe that the product of calcium and phosphorus is greater than 70, and that leads to metastatic mineralization. This rapid precipitation of calcium out of solution causes severe hypocalcemia and neuromuscular signs associated with severe hypocalcemia. This enema also causes water to shift from the vascular space into the GI tract, and this causes dehydration. Hyperthyroidism most commonly occurs in cats due to thyroid hyperplasia or thyroid adenoma. Increased levels of thyroid hormones causes an increased metabolic rate, which causes an increase in the PCV and glucose concentrations due to an increased tissue utilization of oxygen and glucose. Azotemia may result from either dehydration or concurrent renal failure. The urine-specific gravity may be decreased from renal failure or diabetes insipidus. The increased metabolic rate causes increased bone turnover, which can cause hyperphosphatemia and an increase in the ALP activity. Hyperthyroidism also induces a hepatopathy, and this contributes to increases in the enzymes ALP, ALT, and AST.